everyone, and welcome to today's Facebook event. I'm Janet Hieshetter, the Executive Director of the Dystonia Medical Research Foundation, or the DMRF. Our work is focused on advancing dystonia research, promoting awareness and education, and supporting the needs and well-being of affected individuals and families. The DMRF was founded in 1976 by parents whose daughter was diagnosed with dystonia. The DMRF has grown from a small, family-based foundation to a membership-driven organization of over 50,000. Dystonia is a neurological movement disorder estimated to affect 250,000 people in the United States. Today, we're going to talk about a certain type of dystonia that affects the head and the neck. It's called cervical dystonia. It produces excessive involuntary muscle contractions in the neck. It can be incredibly challenging, disabling, and painful. But we'll talk about how to work with your healthcare provider to help manage your health condition. I want to mention that for people who are watching, that every patient is different. And this discussion is not intended to provide medical advice, and we encourage you to speak with your healthcare providers if you have questions about your health. I'm looking forward to the conversation we have planned for today. The discussion is an educational program sponsored by AbbVie. We have a cervical dystonia patient and a cervical dystonia specialist today to talk about this important subject. I'm joined today by Crystal, who has lived with cervical dystonia for the last 3 years, and by Dr. Diego Torres-Russotto, a neurologist at the University of Nebraska Medical Center. Welcome, Crystal and Dr. Torres. Thank you so much for joining us today. Crystal, please tell us a little bit about yourself.
Oh, well, thank you. Well, hi, I'm Crystal. I'm from Fayetteville, North Carolina, and I'm really happy to be part of this much-needed conversation regarding cervical dystonia. I'm a retired teacher. I've been married to a wonderful man for about 32 years coming up. I have 3 wonderful children, and I'm expecting my 3rd grandchild very soon. I've been living with cervical dystonia since 2019.
And Crystal, what do you like to do in your free time?
Well, I love being active, so I am outside as much as I possibly can, playing with my dog, a beautiful boxer, and walking around. I'm finding that I have a green thumb, so it kind of depends on the plant and where I place it. But being able to work in the garden and to plant some flowers and to see them bloom in the spring, as well as in the summer, just gives me a wonderful joy, and I enjoy all of those beautiful colors. I'm also really enjoying being a grandmother, being able just to watch my grandson, whether it's playing soccer on the soccer field on Saturday morning, or having him come over to the house and just sit in my lap and we get a chance to read a book together. I'm just very grateful for those wonderful times.
Yeah, that's great. That's really terrific. Thank you for that. Dr. Torres, tell us about your background.
Thank you, Janet. I am the director of the Movement Disorder Division at the University of Nebraska Medical Center, and professor and vice chair of the department there. I love education and I love patient care. I have hundreds of patients with dystonia. It's one of my focus areas, and I feel it's an amazing privilege to be able to care for patients with this disease.
Well, thank you both for being here today. And Crystal, thank you very much for your willingness to share your personal story so that others can learn and benefit from that. Thank you. There's so much the cervical dystonia community has in common, but everyone's journey to getting diagnosed is a little different. Crystal, how did you come to get diagnosed?
Oh, well, I realized that something was wrong probably around May of 2019. My husband and I were moving a flower pot, and I felt a little discomfort in my neck, and so I went to my family practitioner, described what was happening, and of course was given a muscle relaxant. About a week later, though, the pain seemed to have gotten worse. It was still there. So I went back to the doctor and, of course, was prescribed a stronger medication. That didn't work either. So at this point, it had been over 2 weeks since the incident, and that doctor sent me to a 3rd physician, and at that point, of course, I really wanted to have some answers at that point.
Well, understandably, right? So what happened next?
Well, what happened next is that I saw several more doctors until I finally met a neurologist. He performed so many tests to rule out different diseases, and then he suspected that I had a movement disorder, specifically cervical dystonia. He suggested that I go see a movement disorder specialist at the university near me, where I was able to actually have cervical dystonia confirmed. So finally, I had a diagnosis, and this was about 3 months after I had that initial neck pain. So there was a huge relief for me. I had a name to my symptoms, and someone understood what I was going through. They knew the struggles that it took for me to get there. They were willing to help me too. So I felt relieved and smiling probably more than I had smiled in the last few months.
Yeah, understandably. Dr. Torres, why is it so challenging to diagnose cervical dystonia?
Yes, unfortunately, people may suffer with cervical dystonia for many years before they're able to get a diagnosis. In average, is about 3 to 5 years before getting a diagnosis, and the reason is manifold. Symptoms are subtle. Sometimes at the beginning, and they can vary in the degree of severity over time. The symptoms can be non-specific sometimes, so it's hard to understand, well, is this dystonia or something else for many of the physicians. Most physicians do not get enough training and education about cervical dystonia during their medical school or during residency for primary care physicians. So it is hard to miss the diagnosis.
Do we know what the cause of cervical dystonia is?
Well, we don't really fully understand what causes cervical dystonia. Cervical dystonia causes in the brain a number of mechanisms, and these mechanisms can be induced or caused by multiple etiologies. So that includes things like genetic problems, environmental factors, trauma, medications. So many things can induce those mechanisms in the brain that then produces the symptoms of cervical dystonia. It also, this disease typically begins in the middle age. On rare occasions, it can start even earlier than that. Yeah.
What are some of the common symptoms?
So the most common symptoms in cervical dystonia are twisting of the neck, twisting of the head, abnormal postures in the head or neck. Sometimes shaking can occur. And the reason is because dystonia is caused by excessive muscle contraction. So the muscles are working too hard. These muscles that maintain our head in a particular place, in a particular posture. So by them working hard, they're really fighting each other, and that you can have then these abnormal postures or even the shaking because of that.
Crystal, how did you manage that time while you were searching for a diagnosis?
Well, it was a very stressful time for me,
Sure.
Janet. I was not used to having a chronic condition. I was not used to having a chronic condition at all. Had been in fine health before. That summer, I had a lot of professional commitments. I was still working. I was a program director for an English department at a community college. And so I was also working on a very large community event. So that involved many authors. So I needed people to feel confident in me. I needed to feel confident in myself. And the last thing I wanted was for them to see that I was struggling. So
Sure, understandable.
Yes.
How did you handle it on a personal level?
Well, I tried to avoid my extended family. I found myself being very isolated. I didn't want to see anyone. Usually my sister-in-law comes over to the house for Sunday dinner, and I find myself not going at the dinner table.
Yeah.
So they would eat, and then I would go and grab dinner, and then grab my dinner and then go to the back of the room. I just didn't want anyone to really see what was going on.
Yeah, I can certainly understand that. Were you able to keep that up, though?
For a little while. but I will say that my son actually got married during this time. And so being able to participate in that mother-son dance at the reception was just absolutely wonderful and very important to me. Unfortunately, the night before the rehearsal dinner, I was in a lot of pain. I probably had pushed too much. And so I had to leave the rehearsal dinner early. So I felt horrible, but my family was so understanding and so supportive.
Yeah, and you were able to dance with your son at his
I
wedding.
was able
Oh,
to dance with my son.
congratulations.
Thank
That's
you.
wonderful.
Thank you.
So how did you get through that time?
Well, I used to, when I would commute, I would try to compose myself, listen to music. I also found, meditation worked well. Nice, soothing music to kind of help me with that. My husband has been a rock. He's been very supportive, a great supportive system for me. He and my children, my parents remind me to be as optimistic as possible.
Yeah, that's very important. Yeah. Dr. Torres, we've talked a lot about the challenges of getting diagnosed with cervical dystonia. Tell us about the treatment options.
Yes, so cervical dystonia treatment is not one size fits all. The treatment has to be customized for every individual, every patient. And although there is no cure, there are many treatment options available for our patients. In most cases, the appropriate physician to treat cervical dystonia is one who specializes in the disease, like movement disorder experts, as Crystal was explaining. Physical medicine and rehabilitation doctor, PM&R doctors, also can treat the condition as well. So it is important to find experts in cervical dystonia because that expertise is key on the diagnosis and on providing a proper treatment plan. The treatment really requires open communication, patience. It's a slow process. You have to deliver a lot of information, clear expectations, so to ensure that we get what we're looking for. Among the treatment options, the ones that are most commonly used are physical therapy and rehabilitation, medications that are taken by mouth, oral medications, and also injected medications. In some extreme cases, some patients even require surgery.
Crystal, what has your treatment journey been like?
Well, I was lucky enough to find a doctor who would listen to my questions and my concerns, and so together we were able to find a good treatment path. I learned that managing my treatment expectations was extremely important.
Yeah, I'm happy to hear that. That's congratulations. That's good news. Dr. Torres, we spent the last 2 years in a pandemic. And many people have not been able to see their doctor as regularly to discuss the signs and symptoms of cervical dystonia. So what would you say to someone watching?
Yeah, it has been a very difficult 2 years. I completely understand. But cervical dystonia is not something to ignore. I would encourage every patient to make that appointment with a healthcare provider that can help them with making the diagnosis and providing the treatment, because if you don't know what you have, then you don't know how to fix it. It is key to make a diagnosis so that you can get access to the proper treatment.
Crystal, what are the top 3 things you have learned from managing your cervical dystonia?
Well, first of all, I'm not alone, and I didn't need to go into isolation. I have this condition, and it's absolutely nothing to be ashamed of. When I was first diagnosed, I was nervous about what it would mean for my future. My neurologist looked at me and he said, "You have a movement disorder and you may have to change a few things, but you don't have to let it define you." Second, joining a community can help. I got involved with a support group in North Carolina, and it's done wonders for me. The Movement Disorder Clinic sent out a newsletter that I received, and in one issue they indicated that they wanted to start a support group for people. And they were looking for individuals who would be willing to serve as support leaders. It didn't have to be permanent, and you didn't have to do it forever. And they were looking for one person. And so I said I would be willing to do it. I immediately sent an email expressing my interest because I really did want to know if there were others. It was great once the group came together for our first meeting and we began introducing ourselves and talking about the type of dystonia we have and finding out that other people who lived with cervical dystonia, and they had it for many years. They shared their story and how they overcame those challenges, and it really inspired me, and that type of attitude definitely helped me. I'm hoping that hearing this story today will help others in their journey, whether they're at the very beginning and they're trying to figure it all out, or in the middle of their journey where they may be isolating themselves or working with a doctor to discuss their treatment options. The third thing I would say is I learned to be prepared and to be patient. It's okay to go through emotions. It's normal, actually. Taking notes and journaling, as I had done, proved to be somewhat cathartic for me. And it's also very informative for my healthcare provider as well.
Yeah, lots of good learnings there. Thank you. Yes. And I also want to thank you for your role in establishing and leading that support group in your state. It's a wonderful resource for people with cervical dystonia. You've really helped so many people and filled a great need.
Thank you. Thank you.
Dr. Torres, any advice from you?
Well, you know, after all that we have talked about, I really want to emphasize that if you're experiencing any of the symptoms that we have talked, head tilting, muscle tightness, abnormal head postures, head shaking, neck pain, if you're having any of those symptoms of cervical dystonia, please go and get it checked out, evaluate it by a physician with expertise in the cervical dystonia or movement disorder expert, so that they can help you figure this out. And you know, get educated, learn as much as you can about cervical dystonia. As Crystal was saying, that is so important, to get empowered by knowledge so that you can make the best decisions for yourself. And there are many resources, and you know, the Dystonia Medical Research Foundation website has such an array of information there for patients with cervical dystonia. And there is even this screener that you can take, and you can input all of your symptoms in there and see if they fit the diagnosis, and then from there you can, you know, you can go and find somebody to help you.
Yeah, that's great. Sort of like a little mini quiz on the site. So yeah, terrific. I'll add as well that if you've been diagnosed with cervical dystonia or think you may be experiencing symptoms, I encourage you to visit our website, www.dystonia-foundation.org, to learn more about this condition. Thanks to everyone in the audience who joined us for today's discussion about cervical dystonia. Many thanks to Crystal and Dr. Torres for participating in today's discussion. And finally, I would like to thank AbbVie for sponsoring today's program. If you want to share this discussion with others, the full video will be available on the DMRF's Facebook page and on our YouTube channel. Have a great day.